Hello, class. My name is Heather Hembry, and I'm here to present pharmacology medications for mental health diagnosis. We'll be discussing disorders and medications to treat the disorders, alternative treatments, and social workers' responsibilities within this realm. Medications are often used to treat diagnosed mental health disorders. Each area of diagnosis has a different plan of treatment, which may include medication with psychotherapy, medication only, or psychotherapy with alternative tools to medication. The first area of disorder is anxiety. Primary medications that are used include antidepressants or SSRIs, selective serotonin reuptake inhibitors such as Zoloft, Paxil, and Prozac. Secondary medications include benzodiazepines like Xanax, Valium, Klonopin, or Ativan. Also, non-benzodiazepine anti-anxiety medications such as buspirone. Tertiary medications include TCAs, antihistamines, and beta blockers. And alternative interventions include mindfulness-based stress reduction. Anxiety disorders are described as a group of mental health conditions that present with excessive persistent worry or fear that interfere with daily functioning and do not align with real danger. Normal and expected anxiety can be temporary and motivates the person to achieve tasks. Anxiety disorder is overwhelming, disrupts daily functioning, and can worsen over time. Bipolar and mood disorder medications include lithium or carbolith, secondary lamotrigine, tertiary clozaril, and alternative methods include CBT or cognitive behavioral therapy. Bipolar and mood disorders present with mania and depression alternating. The medications used to treat these disorders include the primary lithium, which helps to treat acute mania and manic depressive symptoms. The secondary anticonvulsants have been found to work for bipolar as well and offer mood-stabilizing qualities when lithium medications are not effective. Tertiary medications like clozapine offer a broader neuroreceptor reach, but have side effects that make it a last resort medication. Alternative methods to medication include CBT or cognitive behavioral therapy and assist the client in psychotherapy to challenge unhealthy thinking patterns. Personality disorder medications include antidepressants or SSRIs, such as fluoxetine and sertraline, mood stabilizers such as lamotrigine and topiramate. Secondary medications include atypical antipsychotics like risperidone. Tertiary medications include the supplement omega-3 fatty acids. Alternative methods include psychotherapy. Personality disorders include severe depression, severe mood swings, trouble with concentration, and fatigue. No medication is determined for personality disorder specifically, and the approach to this area of diagnosis is to treat symptoms within the diagnosis, such as depression and anxiety. SSRIs that treat depression and mood stabilizers are often used first. Secondary medications include atypical antipsychotics, which help with cognitive distortions, anger, and impulsiveness. Tertiary options include the supplement omega-3 fatty acids. This can assist with lessening of symptoms in personality disorder. Alternative methods include psychotherapy, and for the area of personality disorders, this is thought to be the most effective treatment. Schizophrenia spectrum medications include the primary Abilify or Risperdal, the secondary Haldol, tertiary Clozaril, and alternative methods of treatment include cognitive behavioral therapy or CBT. Schizophrenia spectrum disorder presents with behavior, thought, and perception challenges, such as hearing and seeing things. This is thought to be caused by heightened dopamine production. The medications used to treat these disorders act as a dopamine blocker, reducing the amount the brain receives to lessen the symptoms. Primary medications include Abilify and Risperidone, which work as dopamine blockers. Secondary medications such as Haldol are another dopamine blocker that is provided in different dosages, which can be fast-acting or extended relief. Tertiary medication Clozaril is a medication used for resistant patients, but health measures must be monitored closely due to side effects. Alternative treatment options such as CBT assist clients in developing coping skills to address the hallucinations, voices, and delusions. Lastly, trauma and adjustment disorder medications include SSRIs such as Zoloft or Paxil for the primary, amitriptyline for the secondary, prozezin and topiramate for the tertiary, and alternative methods include EDMR, yoga, and mindfulness. Trauma and adjustment disorders include PTSD, prolonged side effects after a significantly traumatic event causing sleep trouble, flashbacks, and being easily startled. Adjustment disorders often have temporary side effects after a traumatic event. Primary medications used for trauma disorders include SSRIs such as Zoloft and Paxil, which help with mood stabilization and sleep trouble. Secondary medication or TCAs such as amitriptyline help with receptor balance and reduction of arousal and other symptoms. Tertiary medications such as prozezin help with sleep trouble. Topiramate helps with mood regulation. Alternative methods in the main approach for adjustment disorders include psychotherapy, mindfulness practice, yoga, and EDMR. EDMR treatment involves rapid eye movement while addressing traumas to offer recovery symptoms. The NASW social workers' ethical responsibilities to broader society include addressing social welfare, participating with the public, addressing public emergencies, and having social and political action. Social workers' ethical responsibilities to the broader society include social welfare, advocating for individuals, their communities, and their environment, and working to advocate for fulfillment of basic human needs, including equal access to mental health treatment and medication with minimal barriers. Public participation includes working in communities to effect policy changes. Public emergencies, providing equitable services amongst community emergencies, such as crisis care and support, are part of the social worker's ethical responsibilities as well. Social and political action, the social worker fights for social justice for support of mental health services through advocacy for change in policy, conducting research and studies to support the change, and then utilizing the data to petition for policy and policy change. Benzodiazepines are a highly addictive medication used to treat mental health conditions, can cause risk of withdrawal if overused, can contribute to overdose in combination of other medications and substances. Benzodiazepines are among medications that are often overprescribed and overused. Dependence and abuse can lead to risk for withdrawal and death if not treated properly. Benzodiazepines can also contribute to overdose in combination with alcohol or opiates. Social workers' ethical responsibilities to the broader society include being aware of the potentials for dependence and abuse with this substance and being mindful of which alternative interventions can be provided to clients. Personality disorders such as borderline personality disorder have symptoms of anger outbursts, emotional instability, unstable relationships, and fear of abandonment. DBT provides a strong intervention. Personality disorders have several classifications of diagnosis. Clusters A, B, and C present with different symptoms within the personality disorder category. Clusters B and C are most commonly treated with psychotherapy alone and not medication. Clusters B have dramatic, emotional, and erratic presentation. Cluster C presents with fear and anxiety. Borderline personality disorder is not generally treated with medication. This disorder presents with intensive anger outbursts, instability with emotions, relationships that are unstable, and fear of abandonment. The most common treatment for these diagnoses include DBT. DBT is used to improve emotional regulation and reduce self-destructive behaviors by utilizing techniques such as interpersonal effectiveness, emotional regulation, mindfulness, and distress tolerance. Those with BPD who engage regularly in these treatments report reduced symptoms. Medication for mental health disorders may be useful in certain diagnoses. Social workers offer a biopsychosocial approach which can provide alternatives to medication or support alongside the medication. Social workers have a duty to advocate for social justice, assisting those in society who need these support systems, and to prevent abuse of medication. Medication for mental health disorders offer an opportunity for those who suffer to find balance and to empower them to live a fulfilling life. As social workers, taking the biopsychosocial approach provides those who are diagnosed with a variety of options that can pair well with medication and therapy. Social workers who follow ethical guidelines of advocacy for the broader society will commit to advocating for equitable services for all and for prevention against abuse of medications. Here are my references. Thank you for your time.